just want to thank you all for your time today. A heads up, we did have some folks who could not make this conversation, so we will be recording it. So that will start now, and then we will have that available post. Just a few table setting things to say. We know that things are changing very rapidly. There are many, many questions on your mind. We have many on this call today from the hospitality industry in particular, who are heavily impacted by these tier changes. Again, announced on Tuesday, Sacramento County will go back into the purple tier, which means that some new restrictions are being imposed on business. We know that that is happening for our restaurants or gyms or churches with a lot of indoor options no longer available. We wanted to create this space today to have a dialogue directly with Dr. Beilenson from the County of Sacramento to give us some information. Then we're going to shift into a Q&A portion. The way that we will manage that today is you have the opportunity to ask live questions. So if you could please, just because we have so many folks on the call, keep yourself on mute until you're speaking. And when you are ready, when you have a live question, just raise your hand. Jasmine Elop from our policy team will call on you, and we will get through all of the live questions first. If you feel more comfortable, you can submit questions through the chat as well, and we're happy to ask those for you. And any of those chat questions, we'll get through all the live questions, and then we'll go to the chat. So again, it's just your opportunity for real talk. I know there's a lot on your mind, and Dr. Beilenson's an expert on this, and he has been very gracious with his time. So with that, I cede the floor to you, Dr. B. Take it away, and we'll move to Q&A when you're done with your opening remarks.
Thanks, Amanda. And you basically got the points in your opening comments, but basically we have 29,510 cases now, so just about 30,000 cases. We're now getting between 300 and 400 a day, which is way up from where we were just a couple of weeks ago. Hospitalizations, we have 153, of which 34 of the people are in the ICU, which is modest for our in our history. And there are about 516 deaths, which is obviously tragic. About 50% of them, 45% of them are in nursing homes, and about 85% of them are 60 or older. But just to put in perspective, we went back to purple this week, which we were very much opposed to. We asked the state, both Olivia and myself, Olivia Casserier, who's our health officer, and myself, specifically asked the state to be much more judicious in how they impose restrictions, based more on data on who actually is spreading the disease than on what they were thinking. And I'll get back to that in a second. But the purple tier, we were, as you may remember, there are two metrics that we're judged on. One is the percent positive tests, which we were in the orange or red level. We actually are 4.6% this past week, which is well below the purple rate. But we were in purple in cases per 100,000, and for some reason, although they give us the penalty of, like, if we had orange and purple, orange and red going forward, we was kept in red. On the converse, when we had purple and orange, we were allowed to be purple, which purple being the worst. So we don't really understand exactly why. We think that part of the restrictions that they are putting on us are really aimed more for Thanksgiving, which we can get to in a minute as well, rather than the businesses. But right now, the businesses, as Amanda said, movie theaters, restaurants, gyms, churches, mosques, synagogues, all are outdoor only. So let me, Amanda, you keep moving around. Let me take questions there, and we can go through the variety of issues that you want to raise as we go along.
All right, Jasmine, do we have raised hands, or I can't see that box?
We have Diane Lally here with a question.
All right, Diane, floor is yours. You're on mute, Diane. You just unmute yourself real quick and you'll be good to go.
Sorry. Sorry. I have a couple questions. So if the governor doesn't have any emergency powers, how can he legally shut us down again? And who decides who should be closed inside?
The state decides. The state decides, and the governor does have emergency powers. They can do orders, which is what they've done. But again, it's the state that decides.
Can I ask you a couple
Yes.
other questions? So we have several restaurants downtown, over 500 employees. None of us want to get sick, nor do we want our guests to get sick. We've had not one employee get sick. Is anyone following the stats on that?
Yeah.
Because
So that's what I was talking about. Sorry to butt in. That's what I was talking about in the beginning, that there should be much more judicious and data driven about this. Just like they're being, as restrictions are gradually lifted, they should be gradually reimposed, not dramatically, not drastically reimposed. So I can tell you that our majority, the vast majority of our cases are nursing homes, Halloween parties, and gatherings in people's homes, without question. It is not restaurants, which is exactly why we made the point to the governor and to the state health secretary saying exactly this. Same with gyms, bars, no offense to anybody who owns a bar, bars are a problem. They just clearly are a problem. But restaurants have not been a problem. Gyms have not been a problem.
well, so right now, gonna just ask you this right out because most of us are barely making it. So if we stay open, what are the ramifications?
Yeah.
Because
So
we don't want to do that. We followed all the guidelines, but it's very frustrating. I mean, how could a mall be open and a restaurant can't? You
I
know,
understand.
I mean,
I understand completely, and I literally we have been on your side in trying to push for this. Let me a couple of things. One, enforcement. We're actually getting the enforcement power. We're going to the Board of Supervisors to be able to fine people, which is kind of going against what you guys are talking about. But we found that as a minority, but a kind of a major minority, are actually completely flaunting the rules. And so people like you who've been following the rules are punished as opposed to those. And so we are actually looking for a fining ability to do that. But getting back to your main point, this probably is not going to make you feel better, but I'll just say it anyway. We are finally at a point where we can see normalcy in a few months. And that's why we're saying for Thanksgiving and Christmas, just for the love of God, please don't gather with family and friends from elsewhere. Just for this one Thanksgiving and Christmas, just have it in a crappy area, crappy way that you have to do everything for the last 8 or 9 months, because the vaccine that is coming as soon as this end of next month, and we'll have plenty of vaccine to do everybody by the end of the summer, will now enable us to be far greater stages of normalcy than we have been. I know it's not exactly a direct answer to your question. You obviously have to survive to get to that. But at least that we are looking now at a real difference. What was the company? Shoot, not Becton Dickinson, Pfizer. The Pfizer vaccine looks like, at least right now, it's about 90% effective, which is dramatically better than they thought it was possibly going to be. That's the level of measles vaccine. It's very good. And there are going to be 4 different vaccines coming into the U.S. starting next month. So if we can, and I know this is difficult to do and it may be impossible to do, but if we can survive for 4 or 5 more months, then we are in vastly better situation where we're not going to have to keep going back into purple. We're not going to keep going back in restrictions because we'll have enough vaccine available to make people healthy. And if I may, the thing that I'm concerned about in the vaccine is not the logistics of getting it out there. We are very good at doing testing and switching around and giving immunizations at the place where we were testing. We're going to do drive-through clinics, et cetera, et cetera. What I'm really worried about is the acceptance of the vaccine by the American people, which most polls show only 40 or 45% of people will get the vaccine, which defeats the purpose of herd immunity. If we get 70% of the people, we have a place that's normal. So that's a very long answer. I understand what your concern is, but that's my answer.
no, can I ask you one more question and then I'll stop.
Yeah, sure.
Okay, so we know we have a vaccine, right? We know that's coming. We've almost been shut down for a year, and you don't, I mean, a lot of people don't understand how we're barely making it. and I get what you say, just hold on, but December is one of our biggest months to put us through to make our profits. And we haven't even, we've lost all those months. Why can't we just wear masks, social distance, and we open 25% because we need this month? Like, we need December.
Yeah,
And
we propose civil disobedience, which is going for a long ways for me in the public health world for exactly this purpose. The problem is that we're going to have a fine. There are going to be fines that are going to be levied against businesses that do this. So, the only thing I would say is, if there's any way. And first of all, I actually worked in the restaurant business when I was younger, so I do understand to some extent what you're going through. But if there's any way to adjust your practices, I know you've done that. I know you've done outdoors. I know you've done curbside, et cetera. But as an example, for Thanksgiving, this is kind of a non sequitur, but for Thanksgiving, for those people who are gonna have people show up anyway, and we gotta deal with that, because it's not gonna be everybody having only their own families from their own personal households. If you're gonna have people show up anyway, you're a college kid who has been exposed to thousands of kids back in Ann Arbor, to grandma so-and-so from Mobile, Alabama, who's coming to see you. At least make it safer. So, for example, Thanksgiving, if you're going to do that, have Thanksgiving lunch outdoors. So it's much, much safer than indoors. And if you do it at lunchtime, it's warmer than if you did it at dinner time. Instead of doing an inside dinner event, if you're going to be outside, put card tables down, so your exposure is down and you're not sitting right next to people, et cetera, et cetera. So what I implore you to do, understanding very well that December is the bad month, it's the important month, is adjust yourself in any way possible to be able to do this. And if you can find a way to adjust, let us know so we can go to the city council and the board of supervisors, and then who have been quite good at letting things happen. So that if there are things that we can allow happen, then we will be able to allow them.
How about the cost? So we have to rent tents and heaters, right? Because I mean, and we pay a lot of taxes to the city of Sacramento. You're losing all that revenue. Who's going to help us do all?
I understand. So there's a couple of things. First of all, do you guys in the restaurant business, I know you're not all restaurateurs, but do you guys in the restaurant business get payroll protection plan money? PPP?
Well, some of us have, but I mean, it's run out.
That helps, right? So I can tell you that there is almost no chance that it won't pass and won't happen. There's a 98% chance that either in the lame duck session or in January, there will be a $2 trillion bill passed. $2 trillion, which will reimburse people for at least part of what they are at loss for. So I implore you to try and come up with any possible alternatives. Make sure you keep very close track, I know you do, of the costs so you can potentially get them reimbursed, and talk to your legislators at the city and the county level who are very much in agreement with what I've been saying and what you're saying, to try and get tax rebates or tax waivers or something to be able to allow you to get through this. Because again, there is, even Fauci, who is very conservative, said today that this is the last New Year's, Thanksgiving and Christmas that's going to be like this. But we got to get through it.
So everyone, Diane, great questions. I want to try to get through some of these as well. And you're asking things that are on everybody's mind. A couple just to address quickly. Immediately after this, our policy team is actively working on our letter, our appeal to the governor's office, as well as to Secretary Galley on just the things that you're bringing up. So specific to Liz's question, yes, absolutely. We are going to continue to behave in coalition. We are going to continue to spread this message. We're advocating for it directly. So no, after this convening, that there will be direct outreach to this group so that we can continue that direct advocacy to the governor's office.
Yeah, and I strongly believe, and I've told Amanda, and I think I told Erica that wherever Erica went, there she is, that is very valuable to have you as a group appeal to the Secretary of Health and the governor, but listing all your businesses, because that's very impressive. If you get, 200-300 businesses coming together as a coalition, that has a lot more impact on the governor than one at a time.
Moving to Terry's question, Dr. Beilenson, while we know there is no crystal ball, how long do we anticipate being in the purple?
So I think we're going to be in purple for a couple of months, just to be honest. I am the most worried about any event of the year is Thanksgiving. I'm by far the most worried about Thanksgiving compared to any other day or any other event, because for the obvious reason that it's the one gathering event for every culture almost in the United States on the same day. And so we're going to, for the 2 or 3 weeks after Thanksgiving, we're going to have tons of cases. And it just bleeds right into Christmas and Hanukkah and Kwanzaa and other things where there's obviously lots of gathering. We have pandemic fatigue. I'm very, very aware of that. We have message fatigue. I mean, there's only so many times you can tell people to wear a mask and to socially distance, which is why we are fortunate now to at least have this pivot where we can say, if you just make it to, January, within months, we will have a vastly different setup here in the United States and in Sacramento. But I think it'll be a couple months.
To Kevin's question, other counties, i.e. El Dorado Hills, have submitted appeals to not be demoted. Has Sac County, who submits the appeal, and what happens when an appeal is submitted?
Yes, and we were denied. It's just that simple.
To Jessica's question, just to clarify, this meeting is for all industries. Yes, Jessica, it is. If you have any other questions, by all means, please put them in the chat. Question from Patrick. Is the governor's office analyzing how much spread comes or does not from restaurants?
Yes.
And the discussion about using airflow rates as a measure of when businesses can reopen. How can the industry help to advocate?
Yes, they do. I know they do. I'm not sure why this is basically, I don't know if you remember me, I've spoken to this group many times, probably, right, Amanda?
Mm-hmm. Yes.
I've spoken to this group a bunch of times. You may remember talking about, instead of going with a blunt object, go surgically to allow to reopen by people that are data driven, not to cause the virus. And instead of blunt force, where you just kind of knock out all the industries at once, that's not very smart because you're not using the data. They have the data. And I'm not sure why. Again, bars, no offense to the people who are running bars. Bars are a problem. They're for all sorts of for all sorts of reasons. Loud noise, people gathering, people drinking, et cetera. But restaurants, particularly at 25%, which is all you've been at, is just not that exposed. And they've not had a large number of cases. There have been some, but not a large number.
Note here from Diane Rogers, for those of you that know about Chambers United, it is a unified effort of all of the regional chambers. Note here from Diane that we will also send these requests to the Chambers United team so that we can provide additional advocacy. Question from Emily. Dr. B, will you consider pushing back the implementation of Sac County's November 13th public health order from 12 noon to the end of the day so that businesses may have the opportunity for dinner service with rain coming tomorrow night?
Sure, we can. I think we can do that. I got to get to Olivia. Just so you guys know, we actually delay it for 4 days as it is. We could have done it on the 12th, but on the 10th, but we left it till the 13th. Yeah, I'll try to remember to talk to Olivia. But frankly, to be honest, although I'm going to get in trouble for saying this, I know. I mean, you can claim that you were busy, that you didn't see it. I mean, I think you can get it. We're not going to go after people for serving dinner on Friday night.
Along those lines, question from Sam. Dr. Beilenson, why are you seeking to fine establishments if you don't believe that restaurants are the source?
Oh, because we're not talking about restaurants. We're talking about other establishments that have been egregiously not playing by the rules. And again, I've got to say that I go around town all the time. And in the last 3 or 4 weeks, I have yet to find a place, a CVS, a Target, except I don't go to places like tattoo places and stuff like that. No offense to tattoo artists, but we have had problems with tattoo people. But I have not seen a single person not wearing a mask in 3 weeks. I mean, they're everywhere. So it's a small number of people, but they're egregious flouters of the rules, and it's really unfair to people playing by the rules.
Question from Michelle: have there been any cases from gyms?
Very few for gyms. So the same rationale goes for gyms, which I've always, as the gym people know, especially the fitness studios know, I've gotten in trouble for opening things. But the same with the gyms. The gyms are not the major source of spread, or even a minor source of spread. Same with restaurants, etc. It's not to say there have been some cases. We have 29,000 cases, but it's not a leading cause.
Question from James: how will antibody testing and contact tracing be implemented to help during this period of time?
So contact tracing is already utilized tremendously. We have 100 contact tracers plus a electronic computer system called Qualtrics, which helps to contact trace. So even with the 300 to 400 cases a day, we're able to keep up. So contact tracing is still, and which is why we know where the cases are coming from. Right? We know they're coming from gatherings. We know they're coming from Halloween parties in the past and recently, and we know they're coming from long-term care. What was I saying? Oh, the contact tracers and antibody tests and antibodies. So for those people who have recovered from the disease, they may well get antibodies, which are protectant and kill off the virus. So you can give serum or blood from someone who has antibodies and give it to someone who has the disease, and it will passively help to cure them some of the time. So that's being used a little bit, like the hospital system are each getting a few dozen cases, a few dozen lots of antibodies.
Doctor,
I
just wanted to add, it's not so much about antibodies themselves, but I have not heard of anybody getting antibody tests.
Oh yeah.
I just hear that.
The reason that you're not hearing many people get antibody tests is because they don't work very well. They've not been very effective. They have new tests that are called T-cell tests. T-cell is a specific type of immune cells that can attack viruses after the fact. And so the T-cell stuff may work better, but the biggest problem with antibody testing is that it doesn't work very well.
A question from Audrey: do our hospitality businesses have access to funds for public relation efforts to help share the hang in there strategy with patrons, any ongoing community support?
So I don't know if they get the federal funds for that. We could probably, the county could probably do that, not for you guys, but for our stuff, because our money is fairly flexible. So two things: number one, investigate whether or not that's true, the federal dollars, the CARES Act, the money that comes in. But secondly, I would, again, you got how many people are on this call? 100? I mean, you got 100 people representing businesses all over Sacramento. Write to your city council people and your board of supervisors, because they could potentially come up with a small amount of money to pay for that.
Oh, Audrey, did you have a follow-up? Audrey, you're on mute. I can't hear you.
All right, sorry. It just seems like the burden is on the restaurant owners, and they're already quite overburdened. So it seems that there should be, an outside agency or, whatever colleague that would come to, that would assist them, because they're clearly dealing with a lot of things that, are not about even what they do. So
yeah, I understand, but these are first, this sounds bad, but these are unusual times, calling for unusual measures, and we have to be willing to do them. And that's part. Second, these are not just
restaurant owners really show that they're willing to go above and beyond.
I know you have. These are all not restaurant owners also, by the way. but although most of them are. But I hear your point. And Troy, I hate to put him on the spot. Is Troy Givens on the call? Troy's our economic development guy, and who could, Audrey, be someone who could coordinate things potentially.
That would be good. That's good information, because again, you know, it's the restaurants are sort of the lifeblood and
I understand.
pulse.
I
So
understand.
a trickle effect happens.
So
and
Amanda, you know Troy. I don't want to put him on the spot, but I think it's reasonable. That's a good point, Audrey. Thanks.
Yes. And again, to all listening, I'll reiterate that the policy team of the chamber will be following up with you. So if there are some things we can do to coalesce to create that, know that we've got your back and we're gonna figure it out. Dr. B, a couple of questions I'm gonna put into one is maybe just clarify, what power does the county actually have on industry? You know, knowing you're saying it's not coming from this, it's not coming from this, but why are we being held accountable? Do you have any flexibility, or are those state mandates?
The very quiet answer is, honestly, although we tried a lot, I tried a lot, particularly in the first half of the year, by allowing gyms to open and fitness studios to open, for example, and the zoo to open and other things, and they got slapped back and they got shut down by the state, although they did reopen them shortly thereafter. The bottom line is very simply, we really don't have much power. I mean, it's that simple. It's a statewide effort.
A question here from Sam. Why hasn't a formal written notification been made to the restaurants that we have to close on Friday?
Oh, because the public health order comes out tomorrow and you'll get it written. It's written.
A couple other questions here around the date and time. Asking if there's any flexibility. Could that be Sunday? Could it be Monday? Or is noon Friday a hard stop?
I'd say that sometime Friday is a hard stop. If you want to serve Friday evening, that's fine. You know, don't get me in trouble. I'm now online. Now I'm on the recording with saying this, but you know, we're not going to enforce on Friday night. But I would please don't do it Saturday and Sunday and Monday.
A question from Diane. Dr. B, could you help us understand why the state is acting with such a broad brush and seeming to ignore the data?
Yeah, so the only thing we've been able to figure out is that potentially they're trying to affect the Thanksgiving stuff, because Thanksgiving is going to be, again, I can't emphasize enough how particularly problematic it's going to be in terms of number of cases, from what we can tell, which is the huge second wave, and we're in the big second wave now. And I'm thinking, so our only thought is that the governor wants to have the cases as low as possible going into Thanksgiving weekend to do that. But otherwise, I don't understand. I mean, California, as he always likes to say, you know, Californians are unusually data driven and unusually forward looking. And so we know the data, and we certainly know the data by county too. And it is not the majority of our cases. So I don't know why.
A question here from Liz that I'm going to frame in a slightly different way, but seems cross purpose that restaurant gatherings for the holiday may be the safest place. By restricting that, you're actually forcing more people into at-home social gatherings. Is there any logic about that choice?
So there's been a lack of logic on a lot of things. I mean, the hair salons thing, I hear them that they can wear masks and prevent disease spreading, but I can't imagine that a hair salon where you're on top of the person breathing on them is safer than a restaurant. I just don't see it. So again, the logic is not there necessarily, and I'm sorry. We have tried. We did try.
A question from Scott. Why is California the only state in our country not allowing small gatherings in hotels?
I don't think that's true. But if it is, tell me, Scott, is it true?
As of about, last week, it was true.
Really?
Yeah. Every other state allows at least small gatherings of up to 10.
Huh. I don't know. I don't know. I don't know. Sorry.
Yeah, that's okay.
I know a bunch of stuff about a little bit about a lot of stuff, and I don't know that. So.
Yeah. Okay. Thank you.
A question here from Patrick. Do you expect the analysis to change and perhaps relax post-holiday?
So I think that may be first of all, again, I cannot stress enough how a group like this, very diverse, all representing restaurants and all sorts of other aspects of life, again, listed by your type of business, your business, not just, this is I'm making this up, the Restaurant Association of California. That's mildly helpful. It's not major helpful. What's really helpful, and I've worked in politics a long time, is all of you signing on a letter listing all the places that you're representing. That makes a big difference. And I think in answer to your question specifically, well, only time will tell, but they may well, after January, relax some of the stuff because they figure there's going to be less major events happening after that. That's certainly possible.
A question from Erica. Dr. B, have you heard any conversations at the state about revising guidelines, such as if restaurants have increased airflow from outside through roll-up doors or similar, they may be able to have modified indoor operations, or reevaluating certain sectors like they did for professionals or for personal services?
Yeah, so I would include that as much as you can in your letter. You know, that several or 80% of us are investigating airflow, blah, 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 blah. Would this be a potential, you know, again, I really think you have some power that we've not been leveraging as much as we could have. Which I'm glad there's this meeting, these meetings.
A question here from George. Do you know what the California Restaurant Association is doing?
Yeah, the part of the problem, I don't know exactly. I mean, they are not negotiating, they are advocating, but they're so big and they're so diverse that in terms of it's worth having a countywide effort to the governor beyond the Restaurant Association of California, whatever it's called, because it is applied county by county. That's the one thing we have going for us, is that the rules are applied county by county. So if our county makes massive, uprising and makes good points, they only have to change the county, not the whole state, which is much easier to do.
All right, well, through all of our questions that were in the chat, we have a note here from Acme Lee. Can we ask a couple questions? Absolutely, floor is yours.
Hi guys, I'm Gabriel. This is Acme. We're trying to launch an escape room business for a few months now. We were slated to open earlier this year, but we couldn't because we're currently grouped in with fitness centers and gyms, and they're allowed to open outdoors, whereas as an escape room, we can't bring our equipment outdoors. And unlike gyms and fitness centers where they're commingling their customers, we only let one private group in at a time, and we follow CDC guidelines to ensure that we sanitize our facility every after booking.
Yeah, it just seems counterintuitive to us that like salons and barber shops are able to operate at 25%. The employees getting their hands on customers, when what we're proposing is if you book an experience with us, our entire facility is essentially in lockdown. No one other than myself or Gabriel will be on site. Masks required to be worn by everyone at all times, and that every touchable surface and object be sanitized between. And see that we can't even afford to pay our electric bill.
Actually, give me a call. So a couple of things. First of all, actually, hair salons are not allowed at 25%. They're allowed at full 100% indoors.
Oh wow!
Secondly, you guys are. I mean, I've been to escape rooms actually, so I know what you do. If you could guarantee that it was a family or in a single nuclear single house, it would be easier. And if you want to, get in touch with me specifically about this.
Okay.
I will try. I can't guarantee it.
Awesome. Thank you.
A question that came in through the private chat is there an appeal process or similar that businesses can do to seek individual waivers similar to what schools have done?
No, so as opposed to what Acme and Gabriel just did, that there are not a lot of, no, in answer to the question, there's, there would not be, like for a restaurant, a specific restaurant would not be able to get off easier. The one exception might be if there's airflow that's been demonstrated to work in other places that may be potentially allowed. But generally they don't do things individually by any means at all.
Question from Scott. Is there a max gathering size for restaurants? Is it still 3 households? Is there a hard number not to be exceeded?
Good question. The indoor, certainly nothing. Outdoor informal gatherings are 3 families. I believe that the level of feeding people, et cetera, outdoors is greater than 3, but I'm not 100% positive. I actually, if I could look up on my screen, I can't do it because it'll lose you guys, but I could look it up. If you go to COVID-19 at ca.gov, covid19.ca.gov, put in Sacramento, and it'll list all the different types of businesses and what the rules are. Again, covid19.ca.gov, and put in Sacramento.
A question from Patrick, and Patrick, if I don't ask this right, by all means, please chime in. Has there been an example of demonstrated good airflow?
So I don't know that well enough. I would hate to say that. I think that there have been, but you know, there's a ton of, the other thing that we keep aware of is there are a ton of companies that are putting out things saying that we're, you know, 100% protective of COVID by doing airflow, a laminated airflow, whatever. They take them with a huge grain of salt. And whoever you get, vet them well.
A question in the private chat here. If you're doing the right thing, but see other businesses not doing it, how do you report that? And
311. So we don't want people to be snitches and rats particularly, but you know, if it's really unfair to your business if you're following the rules and they aren't. So you call 311, and 311, I get the list as well as our code enforcement people, and we respond to anyone. Like if there's 3 or 4 or 5 complaints, I'll go out. If there's 1, I generally don't go out because it's not, you know, maybe not one-off. But generally we go out for issues that are raised. So 311.
Question here from Jerry. What is the true definition of an outdoor dining patio? How is that enforced? For example,
Yes.
4 walls, 1 wall, ceiling.
Yes. So it's the walls. I'm trying to remember. It's more than 3, but less than 1. But I'm sorry, it's less than 3, but more than 1. I think it's 2. But you've got to, you know, you can't have plastic, whatever, around 2 of them and then 2 hard walls. You got to have it. It's got to be open for the airflow, because the key to the open air market. Sorry, I'll be back to you in a second, Diane. Is the open air thing has to be open air. That's what's really crucial. Yes, Diane. Your thing's off.
So one of our frustrations, and again, we could deal maybe with outside, but actually under the guidance, a tent can only have 1 wall, which is not a tent. So really, I mean,
well,
we can't, it's 1 wall. It's 1 wall with a roof.
Yeah, but
so
with
how
the
is
posts,
that a tent?
with the posts, so they're actually standing, right?
So it's 1 wall, but you have to have 3 walls open according to the guidance on.
Yeah, I understand that, but there are 4 posts, right? They keep it standing. I'm not saying that it's an issue that there's only 1 wall, but there's 1 wall and the thing stands. Correct?
Yeah, but 3 sides are open. So if it's 50 degrees outside, I don't care how many heaters you have in there, you're not going to want to sit outside. I mean, we can't do, we seriously, I'm sorry, but we cannot do this any longer.
I understand, and things have been difficult, and the descriptions of the things are difficult to gather as well. But to be honest, 2 walls would not be any better, right? I mean, you really need 3 or 4 walls.
If I could jump in, 2 walls would be better. It's
Really?
not ideal, but it definitely would be better than just 1.
Or 3 walls and 1 opening.
Yeah, that's not as good. Well, I don't want to tell you what to do, but you know.
What if all 100 restaurants just stay open? What are you gonna do?
Shh. I didn't listen. I didn't listen.
Okay. Well, there you go, guys.
Okay, next.
We've got some questions here just on jurisdiction, on appealing to city councils or mayors or county or state. Could you just give kind of another clarification on, is there any local jurisdiction here?
So Sacramento City represents 500,000 Sacramentans. Mayor Steinberg is the mayor. The Board of Supervisors represents all people in the Sacramento County, which includes the city, but they tend to focus outside the city. There are 5 supervisors: Kennedy, Cerna, Natoli, Frost, and Peters. And those are the people to appeal to for things like tax breaks, for things like revenue, for things like small amounts of money for PR campaigns, et cetera, et cetera. But they're not going to have status in terms of changing the rules. That's got to be at the state level.
Acme Lee, I see that your hand was raised in the chat. Was that from earlier, or did you have additional question? Great. Question in the private chat. Some schools have reopened in the past couple of weeks, some as early as this week. Are we seeing any data there? Do you anticipate closures?
Some pools?
Schools.
Oh, geez. Yeah, so this it's kind of cold. I mean, for about California anyway. Yeah, schools, it's a non sequitur, or it doesn't really make sense. If a school has started in-person schooling, hybrid or otherwise, and we turn purple, they are allowed to continue to serve kids. Any school that is only online up till now has to wait for us to get to red for 2 weeks. So that's the rules. Don't ask me why. So the answer to your question is, sure, I expect a lot more cases to happen. We have 300-400 cases a day. There are a lot more that are asymptomatic, and there are a lot of kids out there that are going to school with a bunch of kids. I think there probably will be.
A question here. We talked a little bit about fines. Are there any warnings prior to that? What is that?
Yes. We're trying to do this predominantly on education, and we really only want to go after the people that are purposely behaving poorly. For those who don't know or who say they don't know, we'll do education first, yes.
Allison has a little bit more complex question about tenting and heaters. Allison, floor is yours.
I may not be able to answer it.
I'm with the Downtown Partnership. A lot of our businesses ask us with the tenting guidelines, not only about the 3 walls open, but with heater and fire. It doesn't really seem like fire is willing to be lenient on any of their restrictions. So even if they can have a tent outside,
yep.
There's just very mixed signals on if you can have a heater or not, depending on what type of heater that is. Is there any effort from the county to work with fire to help create some looser guidelines? Why?
Yeah, I'd be very happy to do Metro Fire and City Fire. Those are the 2 entities. Just email me Beilenson P. You can get my email. Yeah, email me and I'll get it set up.
Okay.
Follow up, which you may have just answered here from Jerry. If folks have another question for you, is there a way that they could ask that's not in this,
Yes,
form?
sure. Beilenson P at SacCounty.net. I get back almost every single thing by the end of it, and by the end of the next day, usually within a couple hours. But it depends on if I get 80 emails or something.
And Jasmine posted as well that all the contact information and resources we talked about today will also be circulated to this group after. So if you didn't get that right in this moment, know that we'll circulate that.
Is that Jasmine Hallup?
Yes. Question in the private chat. Is there still PPE available?
Yes.
And how might
yes, although it's going to run out pretty quickly, I think, because we're getting hit by a lot of hospitalization. Let me make one point. I think we have a few more minutes, but make a point. For those who say, or you hear from people that this is only a 1.5% fatality rate of the disease. In other words, 98.5% of people get better. Why are we killing businesses, and why are we ruining lives and why are we keeping everything closed? And the answer is the following. First of all, 12% of people over 65 die of this disease. That means of every person that gets this disease, 12 of every 100, 12 die, which is pretty darn high. And we're not talking about just nursing home patients here. We're talking about 65 and older. So it's quite dangerous for older people. But really, the biggest, and obviously 240,000 people have died, which is not a small number. And they are all due to COVID. And in fact, there's probably excess deaths beyond COVID. But really what is almost as important is the long haulers, HAULERS, what they're called, that between 10 and 30% of all people who have COVID, severely and not severely, 25-year-old and 80-year-old, a whole range of people, asymptomatic and symptomatic to some extent, potentially a third get mental illnesses, develop mental illnesses, not necessarily schizophrenia, I'm not saying that, but anxiety, depression, etc. 10 to 30% get brain fog, fatigue, respiratory problems, cardiac problems, heart problems, blood clots, etc. for months on end. So we're talking more like 2 to 3 million Americans who are affected by COVID, either through death or severe illness. That's really the reason that we're so concerned. And so I strongly encourage you all to get vaccinated when it comes out in the near future. And if we do, we will go back to a real sense of normalcy. Sorry for the soapbox, but that's my prerogative, I guess.
All right, quick time check. We've got about 10 more minutes. It looks like we've asked all the questions that were in the chat. Open floor to those who had an additional question, or just a reminder to pop it in the chat if you haven't yet.
Dr. B, it's Erica. This was addressed a little bit on the call this morning, but if you have any insight, I think you're highly aware of some of the challenges our businesses are also facing from our homeless community. And it's beyond just the impact on their business and their customers. There's also a health and safety concern. You have folks walking in without masks. Right. In that regard, does the county, knowing the role you guys play with mental health, is there ability to increase the capacity at the mental health hospital or similar, where knowing we can't put these people, nor should we probably put some of them in the county jail, but even if we got 50, 100 off the street and in the mental health hospital, it could make a difference both for them, but also for our businesses. Yeah,
a couple of things. First of all, we want to serve the mentally ill homeless, particularly, which about 30 to 60% of the homeless are mentally ill or substance use. Putting them in jail makes absolutely no sense. It's a waste of money, and it's a waste of taxpayer dollars, and it's not going to get them better. Third, the ability there's not a large ability to increase the amount of mental health facilities around right now. But fourth, and more beneficial, is we're working very diligently right now, and hopefully we'll come out with a proposal next week or 2 or 3 weeks on actually rehousing homeless people in a range of things, from shelters to tough sheds to safe parking areas, all sorts of things to keep them off the encampments, which is terribly unhealthy for themselves and not great for everybody else. So we are actually doing that.
George, I saw your raised hand, old school style, raising your hand.
Thank you. Yes, Dr. Beilenson, I just want you to know, I feel like you're very on our side of this situation. I appreciate it. I just feel like we're being targeted. Again, the restaurant industry has been through almost 9 or 10 months of this. Yeah. And many of them have lost their businesses. They've had to lay off their staffs. They can't hire people fast enough if they are allowed to open again. It's really a terrible revolving door. I just feel powerless as a business owner. I mean, the state, the mayor, they don't listen unless we band together as a large group. Yes. I mean, look at the marchers. I mean, they're on the streets marching. They get the biggest bang for their buck, but we just feel like, we're trying to be good citizens and not trying to cause trouble, and we're getting abused. So right. I just wanted you to know I appreciate your standpoint and your help, your helpfulness. And, you know, I'm just frustrated like everyone else and about ready to burst because
I hear you. And again, actually you gave me an idea, but first of all, a letter from all of you really has some kind of value, has some value. Secondly, although this is Audrey may not like this because it's going to require you to do a little bit more work, and I know you guys are already working a lot, is what about how many restaurants do you have downtown, approximately?
Well, we have five in
total.
Hundreds.
We just have the one on J Street, one.
Hundreds. No, all of you guys.
Oh, there's
How many
probably
people?
100.
How many people work at those places?
We have 150 on it at our restaurant.
Okay. What about just throwing it
one.
out here? Just throwing it out here. What about a parade of restaurants complaining about this one thing that we want to be open to serve you, and this is we pay taxes, blah blah blah. Just throwing it out there. It's a possibility.
Thank you. You're the only one listening, I think.
Well, thanks.
We appreciate that, but we have to band together, I think, and make a large voice heard.
Yep.
Otherwise, we're going to be in trouble.
Okay, Audrey has a question. Oh, never mind. You're saying yes.
I'm saying yes. I mean,
okay.
it's the voice.
Understand.
And it's sad because I can see the businesses, you know, where my business is and where my businesses have been, and it's hard to see them struggling like that.
Yeah.
And
I don't think it's a terrible idea to potentially have a mass march. I mean, at least you will have tried something. Anyway, back. Sorry.
Fork it. I'm just kidding.
Yeah,
I'm totally kidding.
I'd be willing to put something together, you guys, but I need emails.
Jennifer, get them their emails.
No, I mean, like if everyone, I'll put my email out here. If everyone wants to email me.
No, I'm talking about Jennifer and Erica and Amanda, help them get their emails.
No, I think it would be a great thing I mean, we have 6 restaurants downtown.
Right.
I think it would be a great thing because we all want the same thing.
Yeah.
And I think we could, like you said, get our employees out because our employees are starving.
Yep.
So, yeah.
I've got a question here in the chat to Dr. B. Can Sacramento County ignore this order for restaurants?
Yeah, it's a good question. We actually thought about doing that. That's why I was talking about civil disobedience. The problem is we're going to get fined out the wazoo, and they're going to come after us. This happened last time when I tried to open the fitness studios. They threatened to sue us and come after us. I'm not sure exactly what power they had, but they could they can come in as a state and force businesses to shut down. And that's the biggest problem. They have the state agencies, of which there are 7 or 8, that actually have the ability to shut down restaurants or bars or whatever that we don't have. There's ABC, for example. That's the state, it's not us. So the state has a fair amount of power. But we did think about it.
Dr. B, this is Diane. How close are we to going back to, I mean, what is the disparity? Are we close? Are we way off? Or if we made a huge effort, would it make a big difference, or is it not?
We were going to say now try to go red for Christmas.
Yeah.
Just like we did for orange for Halloween. We were very close on Halloween, really close, until the kids, darn them, started gathering, and we got all these tons of cases, mainly because the parents were walking with their kids. It was totally Halloween based. Anyway, we were at orange, almost yellow in one thing, and we were at red, barely missing orange at the other. And that was 2 weeks ago. Now we need to be at 7 cases per 100,000. We're at 18 per 100,000, which is one of the highest we've been at for a while. Our test positivity is still in the orange. That's what I was telling you. There's 2 metrics, positive tests and the cases that you have. But the cases are pretty far out now. And I don't want to be cynical, but I really think it's going to be till New Year's that we're in purple, just because of Thanksgiving and Christmas.
Right, but having that frame of reference, I think, is helpful. So, and for those of you that are talking about doing something in the restaurants, please go way outside the boundary of the city, because there's an awful lot of restaurants out there, and I think others would like to support that at the county level too. So just by way of that.
Okay, one more question.
Dr. B.
Yep.
Kimio Bazit here. Thanks for the time. So I had to drive to San Francisco this morning and spent a long time listening to the radio, and it seems like there's a pretty big disparity or delta between what the CDC and like nationally they're claiming is sort of restaurants' role in the spread. They kept saying 4 times more likely related to restaurants, whereas you're saying in Sac County, it's
We have not seen that.
hardly a
We have
factor,
not.
right? So I mean, is it possible that the state's working off of
Yes.
that information?
Well, to some extent, but they definitely have the county level data, especially in the big counties. I mean, we're 1.5 million people. We're a big county. So they do have it. But the most important point in the matter is that we do, although again, we do have some cases in restaurants. I'm not saying we don't, but we do not have it as a major source of spread, which is why we've been begging them to allow restaurants as well as gyms and movie theaters. Movie theaters are not, I mean, I don't know who's going to them now. No offense to movie theater owners, but 25% getting huge gaps, and they can only fit like 20 people in a room, in a place. At least they could, now they can't. But anyway, to your point, it should be much more specific, and they have the ability to do that, and I don't know why they're not, which is again the reason for the march of the restaurants.
Okay, thank you.
Okay, Amanda.
All right, Dr. B, we want to thank you for your gracious amount of time that you spent, your honesty, your candor. Thank you so much for that.
Sure.
For everybody on this, no, we've got your back, right? We just want to have this conversation. It's real. We get it. I know what you're going through. This is heartbreaking stuff. So the Metro Chamber team will follow up with you after this. Let us know what we could do to have your back. If it's passive, if it's giving emails, if it's distributing resources, and we will be very actively advocating directly through letter writing as well. So stay tuned. We got you. You're not alone. You're not alone in this. We've got your back. So if you need anything, shoot us a note. We will get you Dr. B's email as well. And I promise you all, we will get through this together. I wish I could solve it like that, but we're going to get there. We're going to get there. We've got you.
Okay. Thanks.
Okay, everybody, take care.
Bye.